Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University. And I'm pleased to provide the Public Health Weekly Update with data accurate as of April 5th, 2023. This week, I'm going to address an interesting question, which is why are we seeing so many headlines about fungal diseases, also called mycoses, also called fungi? All of a sudden, it seems like there's a lot of reports in the media about fungal disease. Well, I think there's three reasons. One, we are seeing an unusual spread of a multi-drug resistant disease. I'll talk about that in a moment. We've seen a plant fungus infect humans for the first time. And also, I think a lot of people are sort of attuned to the possibility of fungal diseases affecting people because of a TV show. So let's take a look a little bit about what we know about fungal diseases, also called mycoses. Fungi are plant-like organisms that did not make chlorophyll. It's one of the most widely distributed organisms on Earth. It's actually a kingdom. Remember, King Philip came over, kingdom, phylum, class, order, and so on, with millions of species. And it ranges from single-cell organisms to what may be the largest organism on Earth, about 4 square miles. And they cause a lot of human disease. This one report said more than 1 billion skin infections, more than 100 million mucosal infections, and then serious allergies and more than 1 million deaths. And the NIH confirms about a little over 1.5 million fungal deaths a year worldwide. And there's all sorts of different fungi that cause human disease. You may recognize some names like aspergillosis, candidiasis, and so on. And the way to think about fungal diseases probably is at least for most of us who don't study them in depth, they cause superficial disease like thrush in the mouth, candida, candidal diaper rash, babies, ringworm, fungal toenail infections. They can also cause subcutaneous disease, sporotrichosis, chromoblastomycosis, and of course, most seriously, systemic disease in the blood, the brain, the eye, the lungs, and so on. So recently, about 10 days ago, the CDC reported on an increasing threat of antimicrobial resistance fungus in healthcare facilities, specifically related to an organism called Candida auris. It was first described a little over a decade ago. It's been in the States, recognized in the States for about 7 years. But the CDC reports that it's been increasing every year, with the most recent increase in the last year. And as they say in this quote, that's spreading at an alarming rate in U.S. healthcare facilities. It spreads by contact with environmental surfaces or from person to person. And apparently it survives for quite a while on surfaces. It's generally not a threat to healthy people, but to those with weakened immune systems or those with indwelling catheters or tubes, it can be a very serious problem. It can cause serious bloodstream infections, and at least 1 in 3 people with invasive disease die. So it's quite serious, and unfortunately, increasingly it's found to be multi-drug resistant. It's occurred in about half of the U.S. states. This is total numbers, so it's not a rate. It doesn't give you that much sense. But you can see that it's all over the U.S. and it's spreading widely around the world. So certainly something we need to pay attention to. We are concerned about it, of course, because even though it's relatively rare, and even though it's largely limited to ill patients in healthcare settings, it has the potential to become more widespread, which, given its multi-drug resistance, could be a real public health problem. One article made the comparison with MRSA, multi-drug resistant Staph aureus, that also started as a hospital-based phenomenon, but then became more common in the general public. So certainly something to pay attention to. It's not a public health disaster yet, but it's worth watching. The second headline is just one of interest, and that is the first time a plant fungus has been documented to affect humans. Paratracheal abscess by the plant fungus, Chondrosteurium purpureum, the first case report, and is reported in medical mycology case reports, which I suspect most of us don't get. And it was a case of a 61-year-old researcher in India He is a mycologist. He does study fungal diseases, but he doesn't work with this particular organism. He had an abscess in his throat that was found to be due to this organism that normally is associated with plant disease causing silverleaf disease, which can be lethal to a variety of plants, notably in the rose family. Now, why he got this, no one knows for sure. It's not typical for plant fungi to infect humans. And the concern is that as global temperatures rise, an increasing number of organisms, possibly including fungi, may become adapted to surviving and thriving at human body temperature. So one of the reasons that fungi don't affect us now is because they're temperature sensitive. Now, this doesn't mean we're going to see anything like this happening in the near future, but I think metaphorically it does represent a threat in that the more things change, as climate changes, as population density change, the nature of human interactions change, we are going to see both new diseases and worsening diseases. And some of the worst can be fungal diseases. So why are we seeing so many headlines about fungal disease? Well, first of all, they are important. They kill over 1.5 million people a year. There is at least one that seems to be growing rapidly, both domestically and internationally. That's Candida auris. But we're also worried about the effect that climate change may have on the distribution of fungal diseases, both for humans, for animals, and for plants and agricultural products. So something to keep our eye on. Please feel free to share these videos with anyone who might be interested. We're happy to put anyone on our mailing list. As always, I'd like to thank Dara Young for editing, producing, adding captions, and posting these videos. And if you have any questions about what I've said today or about any other evolving public health issue, please let me know. I look forward to hearing from you. I'll do my best to answer your questions either directly by email or perhaps in a future weekly update. So until next week, please be well.